Hi everyone, my name is Masira. I work for Mind in Bradford and the chair of the Women's Health Network. I know a lot of women were kind of a little bit worried about how the COVID-19 vaccine affects things like the menstrual cycles and fertility, so we thought today we'd have that conversation with Dr Virginia Beckett.
Even if you're young and fit, you need to have the vaccine, because we know that people, even though they were young and fit, they got so sick that they were on intensive care, and some of them very sadly died. And also we know that there's a risk of developing long COVID. There's 1 million people in the UK living with long COVID. We need to take this virus seriously and to use the only weapon that we have, and that's the vaccine.
Will the vaccine affect my fertility or my partner's fertility in the future?
So there is no evidence that the COVID-19 vaccine affects fertility either in men or women. There is no scientific mechanism by which the vaccines that we're currently using can affect male or female infertility. And certainly the evidence so far, particularly that coming from the United States, those 100,000 women who conceived by surprise having had the vaccine, is really encouraging. We don't see any increase in risk of miscarriage, for example.
What if someone's pregnant or if they're breastfeeding? Should they get the vaccine?
If you contract COVID in pregnancy, particularly in the last third of pregnancy, you're much more likely to get very sick. So you're much more likely to end up on intensive care. You're about 3 times as likely to have your baby prematurely, with all the significant issues that that has. And the advantage of having the vaccine while you're pregnant is that not only do you hopefully protect yourself from that risk of getting severe disease, you also pass on the antibodies that help to fight infection to your baby for the first 3 months of their life, particularly if you breastfeed. We don't really have any way of predicting who's going to be severely affected. Apart from the fact, as I've just said, we know that if you're pregnant and you get it, you're more likely to catch it and you're more likely to get severe disease. At one point earlier this year, in 2021, 9% of all the patients on intensive care were pregnant. So, I think that's shocking, and personally I would want to protect myself from that.
So if there are changes in my period after the COVID vaccine, will my fertility also be impacted?
The current thinking is that if there is an effect, it's probably an effect on the lining of the womb rather than on the ovaries that produce the eggs. We know that the way the vaccine works encourages a huge response from your immune system, and there are a lot of impacts on the lining of the womb from the cells that are involved with immunity. So if there is a mechanism, that's probably where it sits.
It's reassuring to know that the vaccine isn't going to affect our fertility in the long term. Brilliant. Thank you.